Okay, Dr. Taranova, we're recording this session now and we are live streaming to Facebook, so you can go ahead and take it away. Okay, Dr. Taranova, we're recording this session now and we are live streaming to Facebook, so you can go ahead and take it away.
Good morning, everyone. Over the past 2 days, we have heard a lot about violence, methods for addressing it, innovative strategies, numbers, statistics, many different topics, very good topics. Before we dive into the session, I would like for you all to do the following. Just close your eyes. Close your eyes for just a moment. And think of your house. Imagine walking out of your house, walking out of your home, walking towards, say, mailbox, or maybe crossing the street. Do you see your neighbor? Imagine getting into your car, drive to your favorite mall or maybe H-E-B, maybe stop by the park, walk around. Can you see the people that you're walking by? Can you see some of them looking serious? Some may look joyful. Some walk alone, and some walk with other people, maybe a child, an older adult. Do you know how many of them are possibly walking and remain quiet in silence while suffering, again, silently from an abuse or repeated act of violence, domestic violence? We all know that domestic violence is a crime that thrives on secrecy and isolation. And an abusive situation may go unnoticed by coworkers, family, friends. The numbers are staggering. We know it. An average of 24 people per minute are victims of rape, physical violence, or stalking by an intimate partner, or suffering some type of violence in our country. More than 12 million of women and men over the course of a single year report those numbers. As the nation marks October as National Domestic Violence Awareness Month, many victims face a worst-case scenario: trapped at the home, alone, or maybe trapped in a relationship with limited financial means and feeling there is no way to escape, there is no place to go, and home is no longer a safe place. As over the last 2 days, we have heard these two terms, domestic and intimate partner violence. We learned that while they may appear to be the same, they certainly have some overlap. Domestic violence and intimate partner violence are still two different terms with two different meanings. Domestic violence is a violence that takes place within a household and can be between any two people within that household, right? Could be parent-child, could be two partners, could be even siblings. Domestic violence can occur between any of them, even roommates. The term intimate partner violence is a similar term, but it describes physical violence, sexual violence, stalking, and psychological aggression, including coercive acts, by a current or former intimate partner. Intimate partner violence can occur regardless of whether the individuals involved are or were living together or not. This distinction is what separates one from the other, which generally refers to violence occurring between residents within one single location, which would be domestic violence. However, both forms of these extreme aggressive behaviors include any behaviors that can intimidate, manipulate, humiliate, isolate, injure, hurt physically or psychologically someone else. Texas recognizes three different crimes of domestic violence: domestic assault, aggravated domestic assault, and continuous violence against a family member. It may be sexual assault, it may be physical abuse, but it does not have to be either. A victim can be controlled or terrorized by many different tactics like emotional abuse, economic abuse, physical abuse. And in relation to legal matters, it is important to acknowledge the legal definition of domestic violence. It is physical harm, bodily injury, or assault, creating a fear that physical harm, bodily injury, or any other physical slapping, punching, kicking, whatever it is, could happen soon. And also sexual assault, stalking, and other means of abuse. All those factors are terrible, terrible to think of, terrible to endure. And unfortunately, statistics are staggering. But what is behind those legal terms? About 1 in 4 women and nearly 1 in 10 men have experienced contact sexual violence, physical violence, stalking. Over 43 million women and about 38 million men experience psychological aggression by an intimate partner in their lifetime. Unfortunately, Texas is home to an estimated 5 million family violence survivors. Look at those numbers. Just in 2021, Texas Council on Family Violence documented the second highest number of intimate partner homicides in the last decade. 204 Texans in 2021 were victims of intimate partner homicide. Psychological aggression is even more common, and we can see it in nearly half of all men and all women. Let's look at those 204 victims. 169 of them were women, 35 of them were men, including 12 members of our LGBTQ community. Homicide perpetrators also shot and killed 22 family members, friends, or bystanders, and that's including 11 children ages 18 and below. During those acts of violence leading to the homicides, perpetrators injured additional 21 victims, including 4 law enforcement officers, 6 children, 11 family members and friends. 256 adults and minor children lost a parent to domestic violence. The numbers are staggering. The numbers are sad. Interestingly, 44% of victims had taken some steps to end that abuse, to end that cycle of violence. But we still had 204 victims that lost their lives. Look at this map of Texas. If you can only imagine a safer Texas, a safer community, would that be great? Are you the one who can help to create this? And I strongly believe together we are the ones who can break the cycle of violence. We can help. We have the power to unite together, unite our efforts, and end the cycle of violence. Violence is costly. Let's look at these numbers. As a society, we all bear the cost of violence. Intimate partner violence and sexual violence can cause serious short and long-term physical, mental, sexual, and reproductive health problems for men and women. They also affect our children's health and well-being. This violence leads to high social and economic costs for women, families, children, society overall. In addition to negative impacts on individuals and families, domestic violence and related crimes represent a significant cost to us, the taxpayers, and to our communities. Look at these numbers. That cost affects all of us. According to figures from the CDC, the cost of intimate partner violence exceeds $9 billion each year. Think about it. $9 billion each year. $6.3 billion of which is direct healthcare related costs. Just think about it. $9 billion. What can you do with that? And imagine if this amount we could spend on prevention, on well-being, on healthy food programs. Additionally, domestic violence also costs employers and our economy $13 billion each year. Adding the cost together, nearly $20 billion a year could be spent on something better, greater. Shouldn't we consider that? We also know that the cost of domestic violence spills over not just on today's situation, but on generations to come. Impact on children is dramatic. Children who grow up in families where there is violence may suffer a range of behavioral and emotional disturbances. This can also be associated with perpetrating or experiencing violence later in the future. Again, we're talking about the cycle of violence. Intimate partner violence has also been associated with higher rates of infant and child mortality and morbidity. We need to think of those numbers and come up with best opportunities to prevent that violence. We all have heard of the adverse childhood experience numbers and what it leads to. We all know that it's also costly, and as you can see, it's not just common, it also leads to other chronic illnesses, chronic diseases, and so any child who was exposed to adverse childhood experience and violence specifically, it will affect their future. Adverse childhood experiences are really common, and we need to look and consider what steps we can take. Why? Because it could be long lasting, affecting not today, not tomorrow, but the children and the children of our children, and continue to cycle through life. But victims of violence are also more likely than people that did not experience any adverse childhood experiences or violence to engage in high risk behavior, such as smoking, substance use. Furthermore, chronic stress can cause various diseases that include heart disease, diabetes. Other symptoms may include lower back pain, headaches, memory loss, difficulty sleeping, depression, asthma. Can you imagine to have at least one of those symptoms? Some of those victims have more than one. It's a chronic problem. It's a difficult problem. And as you can see, domestic violence represents a significant public health problem that has received attention from healthcare providers and law enforcement officers. Interestingly, many health foundations fund domestic violence programs, but not as many have identified domestic violence as a strategic priority. I think we all got to a point where we have to make it a strategic priority, not just to fund periodically and sporadically, but have it as a strategy and work on the steps to prevent future acts of violence. Could it be prevented? Of course, and we will look at this in just a moment. Domestic violence occurs in families of all income levels. Interestingly, low-income households are more likely to report experiencing domestic violence than affluent households. It's not quite clear why, but there's a lot of data supporting that our adverse childhood experiences, our adverse environmental conditions, all would lead to more cases of violence, more domestic violence, more abuse cases. We all have heard of Healthy People 2030. It is a national effort that sets goals and objectives to improve the health and well-being of people in the United States. It aims at new challenges and builds on lessons learned from the previous decades. Specifically, Healthy People 2030 includes a wide range of objectives developed by the work groups, and those work groups are made up of subject matter experts on specific topics. Interestingly, the Healthy People 2030 objectives are associated with targets for decades, and they also include addressing and reducing different types of violence. So why? Because the health and well-being of all people and communities are essential to thriving, equitable society, and violence is a barrier to achieving this thriving and equitable society. So reaching the objectives set out by Healthy People 2030 will require new approach, new strategies. Healthy People 2030 overarching goal are to attain healthy, thriving lives and well-being free of preventable disease, disability, injury, and premature death. Look at those words, disability, injury, and premature death. We can immediately think of the impact that violence could bring to those that suffer. Disability, injury, premature death, they all tie together. So one of the objectives for Healthy People 2030 is to reduce that violence and to address the measurable goals that would include reduction of child abuse, neglect, reduce sexual or physical, adults and dating violence, reduce firearm-related deaths. These objectives are currently in developmental status. What it means is that it is a high priority public health issue that has evidence-based interventions to address it, but it doesn't yet have a reliable baseline data. That means we need to collect more data, address, identify, and learn still a lot more about the problem. After all, if we don't measure, if we can't measure, we really can't make any changes. We can't make any improvements. So what do we hear in this objective? What we hear is that the reduction of violence is the public health objective. So what can we as a society do to achieve this goal and get a healthier, happier, and more productive society? What is public health, and how can we address domestic and intimate partner violence as a public health issue and make our communities safer, healthier, feel better, hope for the future, and reduce domestic violence cases? So let's look at public health. Public health has been defined as the science and art of preventing disease, prolonging life, and promoting health through their organized efforts and informed choices of society, organizations, public and private communities, and individuals. Hear that word? Preventing, prevention. What does that mean? Can we prevent violence? Yes, we can. Can we do it through public health approach? Yes, we can. The focus of public health is on the health, safety, and well-being of the entire population, not just individuals. Yes, we have to prevent on individual level, but we also have to look at the global, at the public health approach. The unique aspect of that approach is that it strives to provide the maximum benefit for the largest number of people. Again, each individual is important, but we have to step back and look at the largest number of people possible that we can influence. Public health draws on science based that is multidisciplinary. And again, this is the key word, multidisciplinary. It relies on knowledge from a broad range of discipline that includes medicine, epidemiology, criminology, psychology, education, economic, and other disciplines. Public health approach also emphasizes input from diverse sectors, including health, private sector, justice, social services, and collective action on the part of these key collaborators, these key stakeholders can help in achieving the goals of the Healthy People 2030 that we just talked about it, and can address public health problems like violence through the public health lens. Public health as health is fundamental resource to the individual and the community and to society. However, the health of neither individual nor population occurs in a vacuum. Instead, it is shaped by a wide range of factors such as income, education, social connectedness, employment, access to quality health care, inadequate and dangerous physical environment and physical conditions in our neighborhoods, in our schools, in our homes, in our workplace are all risk factors that contribute to not being healthy. In other words, public health focuses on what society does collectively to ensure that people have the appropriate conditions to be healthy. Simply speaking, population health focuses on how different groups, agencies, and organizations work together to improve health outcomes, and not just of one individual, but community and society as a whole. Here you can see the ecological model that demonstrates the interconnectedness of an individual's health and society. We're still in the middle of experiencing how an outbreak of that one infection in one part of the world can affect the health of communities across the globe, economies, to include physical and mental health of the global community, worldwide job market, manufacturing, education, all other areas of our lives. So this is just one virus that we're still battling. Imagine when there's multiple factors and all affect, we can have a great impact on public health if we just try to address any of one problem. And everyone has their role in that. Health systems have an important role to play in advancing population health as a convergence science. We must create a culture, ecosystem, and incentives to bring relevant sectors together and establish frameworks that integrate knowledge from many disciplines and implement the new convergent science of population health. Why? Because addressing and improving population health, improving public health, requires an interdisciplinary approach. But what is health and what determines that health? Is it genetics? Is it doctors? Is it saying you are what you eat? What is it? What determines that health? Well, health for the individual is determined by all those factors that I just mentioned, and also include other factors such as behavior, environment we live in, the quality of healthcare we receive. Please note the role of healthcare. Do you see this? 10%. What it means is that 90% of the well-being of a society has nothing to do with the delivery of medical services. It is the social determinants that are in place. Social determinants of health are the conditions in the environment that affect a wide range of health functioning and quality of life outcomes and risks. Traditionally, the delivery of healthcare services tend to focus on treating medical conditions, and yet a growing body of evidence demonstrates that social and environmental factors are equal or just as important or even more so important to health outcomes and the likelihood of disease and illness. So yes, genetics do predetermine how healthy we would be, but environmental factors play a huge role in our health outcomes. So Addressing those social determinants of health is a critical aspect of population health management because comprehensive care cannot be delivered without addressing those social determinants of health. I wanted to look at the different factors that will and are making impact on our health. See employment, see housing, see alcohol use, quality of care, see in red, violence and intimate partner violence. You know what? Intimate partner violence and violence, domestic violence, are also social determinants of health, meaning by addressing them, we will have huge impact on our population health, on our healthy society. And so by addressing those social determinants of health that includes violence, we can make an impact. Remember of that multi-sector approach, multidisciplinary approach, that's where the answer is. So this is that ecological model that I just showed you, how interconnectedness of individual, relationship, and community plays together. This ecological model also demonstrates that violent behavior grows out of a complex interplay of individual, their relationship, communal, and societal dynamics. Look at that. Individual that may have witnessed trauma or was abused as a child might display chronic disease symptoms later in life. It could also perpetuate a cycle of abuse. It will, very likely, will affect the relationship that individual will have. It also will potentially affect the healthy choices this individual will or will not make. It might affect the substance use disorder that this individual will acquire through the lifespan, will potentially affect their marriage, their status, their relationship with their partners, and again, lead to the cycle of violence, lead to the cycle of abuse, or be a victim. It will spill into the community. We will see that victims of violence are more likely to have lower socioeconomic status, experience poverty, experience isolation, depression, and other symptoms that are related to that. Again, living with adolescents are often not born in healthy, happy families. They are raised in unhappy families, even if we can call it a family. Cycle of violence can continue. And again, from the small community, from one town, one residence, it will spill to the society. We have to make a decision. Are we accepting the violence or we're making a difference and changing something? We can make not just health impact, but economic impact and see improved economic consequences of those actions. And we can either end the cycle of violence or keep it going. So remember that story of seeing people floating down the river. Why they're floating, we don't know. But if we go up the river, we can see if maybe we can catch those individuals upstream. So instead of treating those chronic diseases and emergency department patients, remember those $20 billion? Maybe we can change something to catch victims earlier, to identify those perpetrators earlier, and catch upstream before anything happens. That nearly $20 billion a year could be spent on prevention and other health needs instead of the direct healthcare services and negative financial economic impact as a result of violence. We can come up with a better plan. All forms of intimate partner violence are preventable, and strategies to prevent healthy and respectful and nonviolent relationships are important at the prevention. Organizations throughout the world also recognize the importance of violence prevention and are reorienting their focus of their domestic violence programs into more preventive strategies. There's a growing intention and consensus in the field among activists and policymakers to focus on the importance of using prevention strategies. Yes, again, it's important to address the victim and address their needs, but it's also more so important to end the cycle of violence earlier. Programs that teach young people healthy relationships such as communication, effectively managing feelings, problem solving, can prevent violence, for example, in the teen dating violence cycle. These skills can also stop violence as they get older. A number of factors may decrease the risk of perpetrating and experiencing of intimate partner violence. So promoting those healthy, respectful, nonviolent relationships and communities can help us as a community together again to break the cycle of violence and stop the occurrence and the reoccurrence of intimate partner violence. The public health approach involves defining and measuring that problem. Remember, if we can measure it, we can make a difference, we can make a change. So measuring and defining is an important step towards public health approach towards solving the intimate partner violence and domestic violence. Determining the cause or risk factor for the problem is an important step too. Once we know the data, once we identify the risk, once we know what we can change it. So determining how to prevent or ameliorate the problem, what we can do, and how to implement those effective strategies on a longer scale, that's the key question. It is important to define the problem that we already know, that domestic violence and intimate partner violence are problems. We know it. It is not enough to know the magnitude of a public health problem. It is also important to understand what factors protect people or put them at risk for experiencing or perpetrating that violence, and the reasons why one person or community experiences violence while another does not need to be explored. Remember, we can identify the risk factors, but risk factors by themselves do not cause that violence. So we need to identify, monitor, and also develop and test preventive strategies. And it has to be happening on the global level. Assuring that widespread adoption of these prevention strategies is the component of public health approach to violence. Again, public health, not just one individual, is a community, but the response has to come as a community from all of us together. If we look at the risk factors of the sexual and intimate partner violence, we can see that lower levels of education, a history of exposure to child maltreatment or certain personality disorder, isolation, mental health, low levels of access to good employment, good wages, barriers to accessing healthcare, those are all risk factors. And we can make a difference addressing every single one of them on individual and also societal level. We can address it at schools, we can address it at community level, we can address it in the doctor's office. Some of these risk factors could be addressed through the health system, but others have to be addressed through law enforcement, employment, spiritual care, small and large organizations. So we need to learn to identify and track those risk factors and be successful in the next steps of implementing the strategy to eliminate and mitigate those risk factors. And this work is not a responsibility of just one sector, one agency. So we cannot put this on the shoulders of just law enforcement or just healthcare providers. Again, it is a communal approach. It is everyone together in the same boat, heading the same direction, fighting for those who can't fight for themselves, fighting for those who will become victims in the future. They may not be victims yet, but they might become victims in the future if that environment that they're growing up with or living in are not ideal, and they might fall victim to violence, whether it's domestic violence or intimate partner violence. This is a community work. There is a work as a public in the public health definition, so we have to pay attention to that. Remember that public health that draws on a science base that is multidisciplinary. This multidisciplinary approach has to include all sectors of our society. The causes of violence are complex and often the product of multiple individual relationship, community, and societal factors. And those factors include engaging in aggressive or delinquent behaviors as a youth, as an adult, as a child, facing issues in employment, finding good employment or losing that employment, having in a living in a conflicting situation in a difficult marital conflict, experiencing violence as a child, witnessing violence as a child, or being a victim. The problem of violence can only be addressed if the focus is shifted from responding to acts of violence. Again, remember, helping that one individual is important, but we have to step towards preventing violence before it starts. And this will require the involvement of many key sectors. Center for Disease Control and Prevention, or CDC, has developed a great resource. It's titled Preventing Intimate Partner Violence Across the Lifespan. Why across the lifespan? Because anyone can face and become a victim of violence from childhood through the age of old age. Think of child abuse, child neglect, elderly abuse, and anything in between that's violence. And it's a public health issue that we have to solve. And we need to use the resources that are currently available to us and unite together. So I would recommend for everyone to peruse that Center for Disease Control and Prevention guidance, because it does identify steps that we can take together. Raising awareness, of course, is very important in developing that rigorous evidence-based program, practices, and policies to prevent violence. And this is essential to stopping that violent behavior before it even starts. Public health has a role in building capacity and expertise within the community to develop and implement evidence-based intimate partner violence prevention. These infrastructure building efforts can work together to identify programs and practices. Efforts to effectively prevent the start of violence also need to focus on healthy relationship across the lifespan. Remember, from the childhood, from adverse childhood experiences through the lifespan, through the adulthood, with a particular emphasis on children and youth. Because if we can stop it right now in our children, we can stop that generational cycle of continuous violence. And early education and prevention has shown to provide the best hope for creating healthy futures and fostering a society without domestic violence. While preventing and responding to violence against women and men and adults requires a multisectoral approach, the health sector has a very important role to play. So again, we have to come to this together, but as a healthcare providers, we have to pay attention to our patients, who comes to us, what signs we see. We have this important relationship with a person that we can ask about their health, and they potentially could open up. But sometimes victims don't want to disclose. So it's important for us not only to be able to screen, to identify, but also to provide those references, those guides, make them available in the public space when the person who may not admit to their healthcare provider that they're victims of domestic violence, but they might grab a resource, they might grab and call that phone number that we can identify. So this is important to be able to have those resources on hand and have them available for public to access and address issues that they may have. Again, this may not happen on the first time you meet the person, maybe not even on the second. It takes time to build a relationship, build that trust. Remember, the person who is abused is probably trusting no one. And so you have to earn, and that's earn the respect and trust that you can gain, and you can access the history and help that individual if they're suffering. In addition to screening for signs of violence and potential risk factors, we as a healthcare providers, we are also as a community need to help to gather that information and provide the local list of local resources. Therefore, collaborating with the community stakeholders and engaging all together in providing that information and the education are the best approaches to solving the violence and intergenerational cycle of violence. So the success of this public health approach is in collaboration and the ability not to just screen for violence and for other social determinants of health that could lead to violence, could perpetuate this violence, but close the loop and connect those that are either at risk or already victims of violence to services, so much needed services. And as a community, we can advocate to make violence unacceptable. For such violence that needs to be addressed as a public health problem. We have to be able to provide comprehensive services and have trauma-informed care approach to every victim or every individual and any patient that walks through the door, any client that walks through the door and asking for help. We have to engage in that population-based approach and together, again, as a community, promote that health education, that steps towards prevention of violence through early identification and appropriate referrals and support. We as a community and influencers have the power to engage other influential adults and work on disrupting the cycle of and pathway towards violence through screening for those social determinants of health and identifying the risk factors that can lead to violence. We have the power to make the greatest impact. Strengthening the economic support for families and focusing on early intervention and education will have the biggest return on the investment. through the screening processes and implementation of referrals and services, we can identify and better support survivors and increase the safety and reduce harm to those screened positively, but also to the community at large. The strategies and approaches represent the best available evidence to address the problem of violence and intimate partner violence. It is based on research which suggests that the strategies and approaches described today have demonstrated the impact on rates of intimate partner violence, domestic violence, and on risk protective factors. The main idea is that when multiple sectors, such as public health, healthcare, education, justice system, come together to include domestic violence advocacy groups, to include the legal sector, and the many other large and small organizations that comprise our society, when we all come together and work towards reducing and eliminating that violence and addressing those multiple social determinants of health, we in turn will prevent domestic violence and intimate partner violence, and also prevent their enormous negative consequences on our society. It is through these multidisciplinary partnerships and public health strategies we together as a community will be able to facilitate protection, safety, and independence. Will you embrace this concept and work towards addressing it? Will you take your part? Will you be able to partner with all of us together in achieving the Healthy People 2030 goals? Will you do your part? Thank you, everyone. I'll be happy to take questions.
Dr. Taranova, maybe I could ask a question as people are populating their questions into the chat, because that usually takes a minute. Could you give an example of the types of things University Health is doing from the healthcare sector approach, and maybe also other arenas that you find where you fit?
Absolutely. As a healthcare provider, as a healthcare system, we're taking social determinants of health really seriously. We have implemented the screening for social determinants of health and training of our staff to ask in appropriate setting our patients, do they feel safe? We're also working with our organizations to try to connect patients to services that they may need. You may be aware that we have one of the largest HIV clinic, HIV provider, PACS clinic. At that clinic, we have a team of social workers that screen patients for potential signs of violence and connecting them to the services. That includes helping them with finding employment, finding better access to food, training them for that employment. We have multiple programs that are addressing those, and this is just like one of the examples. But on the global schema, we are working as a health system together to collect those social determinants of health and violence questions specifically.
That's terrific. I'm going to go ahead and read something that's in the chat. We have several thank yous. Also a note that someone is glad to see the correlation of social determinants of health and the impacts, that's useful to them. There's a question about whether your slides could be available to the audience or not. And if they are, we can get those attached in the chat. Also a question, do all of the clinics collect social determinant of health data from every patient?
So we have been rolling out, and we're still training all of our providers. I can say on the global schema, this is the ideal situation when every single clinic would collect. Do we really collect at every single appointment? I cannot guarantee. But at the same time, our patients have multiple appointments throughout the year. They may be facing pharmacy and they have a pharmacy consult, they might be facing their primary care provider. And collectively together, again, we work as a team. We are working on collecting those social determinants of health. And we might miss patients here and there, but we anticipate shortly to be able to collect social determinants of health from every patient that walks through our doors.
Thank you so much for that. We have a little bit of time and I'm trying to prompt some folks to share how they're contributing to this effort. Of course, the Collaborative Commission on Domestic Violence focuses on all of the sectors really that are involved in our community in the ways that we can impact domestic violence. And it really hits on everything that you covered in your presentation, where you're looking at healthcare sector, the judiciary, law enforcement, community organizations, advocacy groups. So there are several ways to get involved. I'm actually going to take a moment to share what we're doing at the health department. So of course, we look at it from a public health lens, so similar to the approach that you described, but none of us have all the resources we need, of course, to do everything that we want to do. So we selectively work on certain things. We recently, in the past couple of years, ended up transferring the crisis advocacy personnel from the police department to the health department. And we have increased their ranks and added a complement of long-term case management to that function. So now we have a team that is able to provide support around immediate needs and immediately following an interaction with law enforcement that relates to domestic violence. And we're also able to support them longer term to find the resources and assistance they need to make the shift in their situation and in their lives to be safer and healthier. We also do some work in training parents in positive parenting skills. And that's an evidence-based curriculum called Triple P or Positive Parenting Program, and it's intended to prevent child abuse and child maltreatment. We do a lot of work in trauma-informed care. We're trying to certify all of the city departments as trauma-informed organizations so that we help our own personnel and also do a better job serving the community. We have a gun violence intervention program, and while that is focused more specifically around gun violence, we know there's a connection between domestic violence and gun violence. So we're trying several different approaches. And I'm going to go ahead and narrate a little bit more of what we're seeing in the chat for the folks who aren't able to follow that. If you are asking about handouts, we did attach the presentation. You'll see it looks like a PDF icon in the chat. So you just click on that little spot and download that. There's a question from actually the public health officer at the health department saying screening can sometimes constrain opportunities for prevention and limit education to only those who are ready to disclose and who have been screened appropriately. Universal education is another approach. For those using screening, CDC has a table of evidence comparing different screening tools. That's a really helpful resource. You'll find that link in the chat to those different screening tools. Another question, or actually commentary, this two-day event has been so informative and much needed for the army of social workers worldwide because these issues of trauma, domestic violence, ACEs, and other forms of abuse, etc., are a global epidemic. We can always learn more and place new tools in our respective toolboxes. Thank you.
Eric, you shared a kind of nurse-family partnership type of approach that you guys have. This is also one of the programs that we have here in San Antonio in University Health. We have that nurse-family partnership because we firmly believe that, again, educating those young moms, young parents, helping them with those parenting skills will prevent and violence, future violence. They might be in a potential risky situation of facing that violence that will break the cycle. And again, showing someone something positive and having them to look forward to something better, giving them that hope will break the cycle and will bring them out of that desperate situation.
Thank you for that. We did have a question coming in. How effective is integrated behavioral health in addressing the social determinants of health as related to domestic violence? And how are BHCs utilized?
So behavioral health is part of mental health approach, right? We all know that nationwide, we just don't have enough behavioral health specialists. But when we do, integrating them with the primary care, integrating behavioral health specialists within the clinic is a really well-documented, well-studied approach that produces really great results. So if during that screening process, we identify the need, if I refer somebody to see the behavioral health specialist and the appointment is available sometime in 2 weeks, it is very likely they will not be there. They will not be coming for that appointment, much needed appointment. But if we work together and we have integrated behavioral health specialists within the clinic, within the system, and we can connect patients right there at the time when they were ready to disclose that they have an issue, they have a problem, and connect them to the mental health specialist, that's the time when we will be the most effective. So I'm a big proponent of integration of behavioral and mental health as part of physical health. We really cannot separate physical health from mental health. This is all together, right? So when we have a chronic disease, our mental health declines because we're depressed, we're worried, right? We can't sleep. It perpetuates our physical symptoms. So this is all together. So we're all integrated, our behavioral health, mental health, our physical health. So we really should not be separating, this is just behavioral health issues, this is physical health issues. They have to be taken together as a complex and treated together.
I think that's a really great point to kind of bring things together, and something we've all experienced is in our own lives and in the people that we support, different health issues don't stop at an arbitrary boundary. Your mental health doesn't stop at one point, your physical health doesn't stop at one point. It is interconnected, and we need to focus on health and wellness holistically for an entire person. I think that everybody has found that to be the case in their practice and in the work that they're doing. I see another comment, building that trust is important. My doctor truly listens and has helped me to move to healthier outcomes. Even though I don't see her often, if I needed crisis assistance, I would trust and reach out to her. She has built that into her care. Amazed that I have seen that happen in my healthcare.
That's truly amazing. That's truly amazing. And this is the goal, to have our new training doctors in training to also be at that point. You know, we see a lot of it with experienced physicians throughout their life. They learned all these different points, but the goal is also, we have to educate the public. We have to educate general public, right? We have to educate everyone what violence is and how to prevent it. But I think educating the healthcare specialists, that integrative approach and early recognition and building the trust with the patient is extremely important and essential to addressing that violence problem, addressing that mental health issue, addressing that physical health issue as together. You just said something that really resonated with the whole theme over the past 2 days, that, you know, that holistic approach. It has to be a holistic approach. So you have to look at the person as a whole. You have to think of all of that together and integrate all of this together. Again, remember that multisectoral approach that I was mentioning in my talk. That's what it is. It's all together.
Well, thank you very much, Dr. Taranova. It looks like we've come to the end of our comments. If you have any parting words, you're welcome to share that with us. And for the folks who are joining us, you'll have a little bit of break until our final session at 11:30. Thank you, Dr. Taranova. We appreciate your time.
Thank you, Erica. Thank you, everybody.